Hi, my name is Dan, and today I wanted to talk about inflammation and the effects that inflammation has on depression. I was reading an article recently that was going into some of those details, and I decided to go a little further into some of the information to determine the impacts that inflammation has on depression. Inflammation is something that every person has and goes through. In the short term, inflammation can be very helpful. So if you have a virus or a bacteria, you want inflammation to occur to signal your immune system to go to that area and take care of the problem. If you hit your arm or hurt your arm, you want inflammation to signal the immune system to repair cells. So short-term inflammation can be very helpful. Some problems potentially can arise with long-term, chronic, low-grade inflammation, and that seems to be where the connection is with depression and inflammation. Inflammation can be measured through various markers that the body have. So one is C-reactive protein, there's certain interleukins, and then there's tumor necrosis factor, TNF. So that's usually how inflammation and chronic inflammation is measured in people. Certain inflammatory disease processes like rheumatoid arthritis and Crohn's and other disease states can have huge amounts of these inflammatory markers, up to like 1,000 times the normal. And that doesn't seem to be the case for depression. So when there is an increase in inflammation, and that's not all patients with depression, the increase only seems to be about 2 to 3 times the baseline level. In the patient population studies that I saw, roughly a third of the patients that had depression had these higher inflammatory markers. So like I was just saying before, it's not all patients, but it might just be a subset of patients that have those inflammatory markers. One of my questions was if depression leads to inflammation, or if inflammation leads to depression, or they both affect each other and can increase each other. And there was a study that followed patients for over a decade, and this study found that having chronic low-grade inflammation over a long period of time could potentially lead to depression, and it didn't seem to be the other way around, that depression led to inflammation over time. So that could lead to a potential treatments in the future for these subsets of patients that have depression potentially caused by inflammation. Another piece that I found interesting is that inflammation seems to increase the amount of presynaptic serotonin, norepinephrine, and dopamine reuptake pumps. So if you have chronic low-grade inflammation, your cells and your neurons are going to be reuptaking serotonin and your other neurotransmitters, which is how the antidepressant medications work to treat depression, is they block those pumps from sucking those neurotransmitters back up. So potentially in some of these patients, inflammation is causing these pumps there to be more of those pumps, and then we're using a medication to stop those pumps from working, rather than treating the inflammation, which might treat the cause rather than the symptoms that it's causing. So I found that potentially interesting for maybe future research. What causes the inflammation? One of the potential causes of inflammation is stress and trauma. So stress can be taxing on the body, so can trauma. I found one interesting study out of New Zealand that followed 1,000 patients from birth to 32 years old. And what they looked at was that individuals that experienced childhood trauma, mistreatment, abuse were twice as likely to suffer from chronic inflammation than the individuals that weren't. And that makes sense as well, because individuals that have childhoods with neglect and abuse and trauma also have a high chance of developing depression. Next is diet. Diet can play a role in inflammation, and a lot of the disease states that I sometimes see are things like irritable bowel syndrome and Crohn's, and these diseases of the intestinal tract that are associated with inflammation. So certain dietary foods are associated with inflammation, and other foods are anti-inflammatory. I was on one of the Harvard health sites earlier, and they gave a list of foods that are anti-inflammatory. So they had tomatoes, strawberries, blueberries, nuts, olive oil, leafy greens, all anti-inflammatory. And then inflammatory foods seem to be foods such as processed foods, processed meats, red meats, refined carbohydrates, French fries, so sugars. So foods that you would expect that are traditionally bad for you may have an inflammatory component to them as well. So along with decreasing stress and changing your diet, another potential help for inflammation is exercise. So in the short term, exercise can cause inflammation. So you're damaging your muscles by overexerting them, and that's why you feel sore the next day. But after those inflammatory chemicals are released from exercise, your body counteracts that with a bunch of anti-inflammatory chemicals as well. Over time, that kind of dampens the inflammatory response from exercise, and that can translate to inflammatory responses to other things. So exercise is overall helpful for inflammation as well. So I briefly touched on common areas of inflammation by talking about the gut and the GI tract, but some other common areas of inflammation are the skin. So eczema, rashes, contact dermatitis can all cause inflammation. So to help prevent the long-term effects from that is to get any diseases like that treated. Also, another area of inflammation is the mouth. So gingivitis is a pretty common phrase and term, and gingivitis is inflammation of the gums. So proper oral hygiene and brushing and potentially flossing can decrease inflammation in the mouth. And another component of that as well is that periodontal disease, so like mouth diseases in the mouth and inflammation in the mouth, is predictive of cardiovascular diseases and mortality from diabetes, and has all these connections to other serious illnesses, all from just that inflammation that you can get from your mouth. So finding ways to decrease the mouth inflammation, the gut inflammation through dietary changes, and then skin inflammation can all potentially be helpful, not only to overall health, but preventing that long-term inflammation that can lead to depression in certain. Another potential way to decrease inflammation is through supplementation. So a lot of the supplements that I've been reading into in the past that can treat depression also have anti-inflammatory properties, which now makes a little more sense to me. So one is saffron, curcumin. They both have anti-inflammatory properties. Omega-3 fatty acids like fish oils also do as well. Some supplements that I haven't tried that potentially can decrease inflammation are alpha lipoic acid and then ginger. So there's supplements out there that potentially can help depression by decreasing inflammation. The current evidence with inflammation and depression, the best evidence that I could find seems to point to measuring levels of inflammation can help with antidepressant selection. So meaning, I'll go through this study to show you what I mean by that. I found a study from 2014 in Europe that looked at the amount of inflammation that patients had through getting their C-reactive protein level and then treating them with different antidepressants. The patients that had low levels of C-reactive protein, so not a lot of inflammation, responded to the SSRI escitalopram better than nortriptyline, which is a tricyclic antidepressant. The patients with high C-reactive protein, so they had a lot of inflammatory processes going on, responded better to nortriptyline than they did escitalopram. So the potential implications of this study that I got was that measuring inflammation can potentially help with antidepressant selection. I additionally found a second trial that supported this claim potentially as well. So it looked at 106 patients with depression, and they measured C-reactive protein, and the patients either received escitalopram plus placebo or bupropion plus escitalopram. So bupropion is a different type of antidepressant medication that's not an SSRI like escitalopram. And what they found again was that the low levels of inflammation responded well to the escitalopram and the placebo, And then the high levels of inflammation responded better to the non-SSRI medication, the bupropion in this case. So thank you for watching my video about the potential connections between inflammation and depression. So again, not all patients with depression do have those increased inflammatory levels, but in the ones that do, there's potential ways to treat that inflammation, and there's potential implications for medication selection and other ways of treatment as well. So I just found some of this information interesting and could have implications in the future for the treatment of depression. So I wanted to make a short video. So thank you for watching.